Thank you, Mr. Chairman, and thank you, Mr. King, for coming. I want to echo the comments that have been made by the chairman and Mr. Sessions in terms of our feeling like we're with you on this, obviously, since every single one of us voted to repeal Obamacare. But you've just pointed out something that I think needs to be mentioned. We voted to repeal well, I think probably the reason this is HR1 because we knew we were going to be facing the continuing resolution. We knew that we were going to have to continue the funding for the federal government. And Obamacare was number 2. I think that was appropriate that we voted on it immediately. I don't have any problem with that at all. But we know what happened to the bill when it went over to the Senate. At first, Mr. Reed said there would be no vote on it. You know, it was sort of over my dead body. And then there was this dust up over in Egypt. And all of a sudden, Mr. Reed had a good cover when people were paying attention to other things, and he suddenly brought it up for a vote. And, of course, the vote failed. Now, we have been accused over and over again of wanting to shut down the federal government. And we've said over and over again that's not our intentions. We want to go forward with the continuing resolution. We're sorry that our colleagues on the other side of the aisle could not get their appropriations passed last year. But what do you think would happen if your amendment is put on the continuing resolution when it gets to the Senate?
Well, it fits into the same category as what might happen with the $100 billion in cuts. It comes down to where are the votes and where is the leverage. And I have made the point that there's not a dime that can be spent by the federal government unless the House at least concurs. And so that's something that can't be seen at this point. If we had not sent the repeal of Obamacare over to the Senate, we would be accused of not taking up an issue that we believed in. And if we don't cut off the funding to the implementation of Obamacare, the same accusations that we expected then would come on this.
But we are cutting off the funding to the implementation of Obamacare in this bill. We're cutting off the funding as it is available to us to cut off in the continuing resolution. So all of the funding that we can identify that fits within this category is being cut off in the continuing resolution.
And do you know what that total is?
No, I haven't added it up, but it's, I don't know, 300, 500, almost $2 billion.
Yeah. But while that's going on, there's $4.9 billion in this fiscal year that's automatically appropriated. And then the balance of roughly another $100 billion that gets automatically appropriated to implement Obamacare. That unless we find a vehicle to shut it off, Obamacare will be implemented, and it could happen on our watch while we're cutting a couple of billion.
But we have lots of vehicles to shut it off that are coming up. We have the budget process coming up, and we have the appropriations process coming up. And so we have, your assertion is that this is the only chance that we have.
The best
chance. I don't
chance.
believe that is not the case, because we're going to have lots of opportunities to cut off the funding for Obamacare. Again, I expect us to pass appropriations bills, and I believe through the appropriations process, we can cut the funding off in future years. That is an option available to us.
Well, I would submit that the budget process won't be a vehicle, but the amendments, the appropriations will be, but each one of them will be significantly less in the leverage. And so if our leverage diminishes, then our opportunity to succeed in negotiations with the Senate and the President also diminishes proportionally. That's why I think this is the vehicle.
But if we send it over on the continuing resolution and the Senate rejects it, then there is no leverage. So your argument is that there's leverage because it's on the continuing resolution. The Senate doesn't have to accept the continuing resolution, as you just said.
I would submit if the House is not willing to insist, the President will get what he wants eventually.
Well, the House has insisted, and we're going to continue to insist that this not be funded. Every single one of us has taken as strong a position as you have taken. I have railed against Obamacare as much as anybody in this body. I have spoken against it over and over and over again. I write letters against it over and over and over again, editorials against it. I mean, I have no positive thing to say about it. But as you know, you are asking us to change the rules here in the Rules Committee. And what that does then is open us up to the same accusations that were made of our colleagues across the aisle over the last 4 years in terms of their not being fair to us. And I think that is putting us in a very tough position.
Mrs. Fox, I never thought I would be sitting here hearing that asking for a modified open rule in order to shut off the funding to Obamacare was the implication that I should have somehow given a deference and not made the ask. This is too important not to ask. It's too important not to come before this committee and make this case. I would have liked to have had it written into the bill. I would have liked to have had the amendment go before the Appropriations Subcommittee or full committee. I'd like to have had a regular order. We didn't. Now we're to an open rule that says we can't have the vote and we can't have the debate unless there is a waiver provided by this committee. It's the only place I have to make this argument. And as I see it, there may be a disagreement tactically. You may believe and that the smaller appropriation bills offer a better opportunity to shut off this $105 billion. I believe that the more money that's at stake, the more leverage you need to succeed.
But
so that's where our disagreement is.
But Mr. King, you have another opportunity to do this. You can offer the amendment on the floor. Any member can offer any amendment on the floor, and you know that. And so we're not shutting you out from offering your amendment on the floor.
I announced as I sat down here that there will be a point of order raised, and the point of order is likely to be sustained. And I have reservations about challenging the ruling of the chair if I think they have a parliamentary point. It's hard for me to make that argument when I've come before this committee to say my amendment will not be in order. I understand it will not be in order. I knew that from the middle part of last summer. I marched down through all of the things that you can ask a member to do. And my franchise is as precious as anyone in this Congress is, and we have the same passion to oppose this issue. But I have tried every other alternative, and if this alternative does not succeed, the next thing that I'm facing is offer the amendment on the floor, listen to somebody raise a point of order, and I can reserve my right to object and make my argument. But to actually challenge the ruling of the chair when I've told this committee I don't believe my amendment is in order, that's why I came here to ask for the waiver, it'd be inconsistent. I think it'd be morally and fundamentally inconsistent for me to do that. But it is consistent constitutionally for this Rules Committee to evaluate an unconstitutional bill and realize that it's very unlikely that even under the astute leadership of the chairman that we'll go through the 112th Congress without a modified open rule. I expect that will happen. And when that happens, I hope that if I'm not successful here tonight, we're not looking back thinking, well, if we were going to write a modified open rule, why didn't we do it to unfund Obamacare?